Hello and welcome to Healthy Minutes, the program that talks about your health. I'm your host, Dr. Mo. Today's show shifts from diseases and procedures and sheds light on the healthcare system here in Bahrain. The Kingdom of Bahrain has witnessed comprehensive achievements in the field of health, as is evident by key health indicators, including an increase in average life expectancy and a drop in infant and maternal mortality. The health system here in Bahrain covers all areas of the country and is of high adherence to international practices. But before we go any further, let's take a closer look at the health system in Bahrain and the bodies involved in it. All Bahraini citizens have the constitutional right of receiving comprehensive health care. The government of Bahrain has spared no effort in providing quality health services to nationals and residents. This led to favorable health indicators that put Bahrain on the world map, ranking high in terms of health conditions compared to other developed and developing world nations. Bahrain has made outstanding gains and achievements in the different fields of healthcare and the development of its primary, secondary, and tertiary services. In 2010, the report of the United Nations Millennium Development Goals, the MDGs, showed that Bahrain has successfully developed an effective healthcare system through a network of healthcare centers in all its areas. The report said Bahrain was on track with regards to the health MDGs and was meeting global standards, especially with immunizations and maternal and infant mortality rates.
I must say that the delegation was very impressed by your national capacities, and out of the 19 different technical areas, Bahrain achieved what we are calling as sustainable capacity, the highest possible marks on many of those areas. But as I said, the overall capacity is excellent. We were extremely impressed by your immunization system as a good example. You have a very good capacity to detect different diseases, also chemical and radiation events. So I would say that most of the items and issues that we were able to identify were improvements to already good capacity.
The health system in Bahrain is made up of different bodies. The Supreme Council of Health was established pursuant to Royal Decree No. 5 of 2013. Since the establishment of this council, it has become an important cornerstone in the development initiatives in the health sector. The council has played a major role in preparing the suitable foundations and building the necessary strategies for developing the health sector in the kingdom, especially with regards to enhancing the efficiency of health services and sustainability of health resources, as well as coordinating with all concerned parties in both the public and private sectors and building bridges with local and international health institutions. The National Health Regulatory Authority was established pursuant to Law No. 38 of 2009. The authority is responsible for monitoring public and private health institutions and investigating complaints filed by patients. These duties have had a direct impact on improving the quality of health services at these institutions. Since its establishment, the Ministry of Health has been in charge of providing both therapeutic and preventive health services for the people in the Kingdom of Bahrain. The ministry's achievements are so many that they have made a positive impact on the overall health status in the kingdom that has outperformed many world countries. Bahrain has been able to build a solid infrastructure in the field of healthcare, represented in 28 health centers across the kingdom, serving more than 1,314,562 of the population. Their goal is providing family and society healthcare, and those health centers provide several curative and preventive services through medical clinics that are run by highly qualified family physicians at a ratio of 2 doctors to 1,000 patients. The health centers provide many services, including mother and child care, immunization, premarital testing, family planning services, school health care, occupational health care, care of infectious and non-infectious diseases, home visits, and health education. Medical diagnostic services, nursing, pharmacy services, medical records, labs, and X-ray services are also provided, as well as physical therapy services, which are now available in 4 health centers in each of the 4 governorates. Based on the government's strategic plan that aims to continue developing the quality of services, in 1990, clinics for diabetics and the elderly were also opened in the health centers. All primary healthcare centers are accessible by all age groups. They are run by medical and nursing staff that are equipped with the best training in order to provide high-quality healthcare. Salmania Medical Complex is a main provider of secondary and tertiary healthcare in Bahrain. It includes 1,166 beds and various services and outpatient clinics with different specialties, including general surgery, orthopedics, plastic and burns, pediatrics, internal medicine, gynecology, ENT, ophthalmology, maxillofacial surgery, ICU, and other subspecialties. This is in addition to other services such as emergency, neonatal ICU, an oncology center, and genetics blood center. Salmania Medical Complex also performs as a university hospital and medical research center for doctors and health professionals. King Hamad University Hospital, or KHUH, was established by Royal Decree No. 31 of 2010, which stated that the hospital will be affiliated to the Bahrain Defense Force and will offer its services to all citizens. The hospital provides medical services employing best therapeutic and administrative practices and academic and research services with a capacity of 311 beds. It includes operating theaters, adult and neonatal ICUs, and all major specialties. The KHUH also has a physiotherapy and hydrotherapy unit, an oxygen therapy unit, and outpatient clinics equipped with the latest medical technology. KHUH will soon include the National Oncology Center, which will play an important role in developing the level of medical services in the kingdom. Bahrain Defense Force Hospital is considered the second largest hospital in Bahrain and includes all required medical infrastructure and highly trained staff. It includes 412 beds, inclusive of the Sheikh Mohammed bin Khalifa Al Khalifa Cardiac Center. The hospital provides healthcare services to military troops, in addition to emergency and specialized health services to citizens and residents. The Royal Medical Services provides secondary and tertiary health services. A specialized burns unit was established in 2014 and was opened for service in 2015. The number of public and private hospitals in Bahrain have amounted to 26. According to reports published in 2014, the number of total hospital beds in Bahrain amounted to 2,107. 500 more beds will be added in the next 3 years after completing the construction of new projects in government hospitals, including King Abdullah University Hospital, Sheikh Mohammed Al Khalifa Cardiac Center, and the Oncology Center at the King Hamad University Hospital. In 2014, the ratio of physicians to the population was 25.3 physicians for every 10,000 people and 50.1 nurses for every 10,000.
You're watching Healthy Minutes with Dr. Mo.